Hello Nursing 400. Today we will be demonstrating a reminder on the 6 medication rights of administration with a situation that we've all been through, giving an insulin injection. To review, the 6 rights of medication administration are the correct medication, the right dose, the right time, the right route, the right patient, and the right documentation.
First, you need to make sure you have the right medication. Check the expiration date and dosage. It is a rule of thumb that a medication gets verified 3 times. Right when a medication is acquired, just before opening or pouring the medication, and prior to administration. Also, make sure that the patient is not allergic to any medication you're giving.
With every medication you administer, you need to know the normal dose range. As well, triple check the drug and dose with the drug label and MAR.
It's very important to be aware of the correct time that the medication is to be given, as well as how many times a day it's to be administered. It is acceptable to give most medications up to 1 hour before and after the prescribed time, but you should always check with your hospital's policy regarding this timeline.
The right route of medication dictates a variety of medication traits, including its activation time, the body parts affected, and the overall physiology of the medication in some cases. The various routes include oral, sublingual, topical, rectal, transdermal, inhaled, and parenteral, divided into intravenous, intramuscular, intradermal, and subcutaneous.
Before administering medication, you always want to make sure you have the right patient by asking them their name and checking their wristband. You always want to have 2 patient identifiers, the name and date of birth. You can also look at the MAR for the name and prescription, as well as the patient chart.
The right method of documentation is also an important part of the 6 rights, as it provides the hospital staff or any other party legal reference to any action taken in the hospital. Proper documentation prevents the risk for duplicating medication doses and provides a thorough history of a patient's stay within the facility, because remember, legally, if it wasn't documented, it didn't happen.
Now we're going to be teaching you how to give insulin using the 6 rights of medication.
Nurse Chang needs to administer insulin to his patient. Let's see how he uses the 6 rights of medication administration.
It says right here that I need to give 4 units of insulin to my patient.
What are you doing right now, Chang?
Oh, hello, Professor. It says on the MAR that I need to give 4 units of insulin to my patient right now.
Okay, well, let's just double check with the name and the drug label and we'll see if that's correct.
Okay.
So let's look at the MAR. Okay, looks like that's right.
Let's watch Chang prepare his medication.
So, Chang, did you check the expiration date on the Lantus?
Yes, Professor. It expires March 2015.
Okay, great. And what are her allergies?
I believe he is allergic to penicillin, and that's about it.
Okay, I'm glad you checked. Okay, go ahead. Prepare your medication.
Okay. First, I need to wipe it with an alcohol swab. Next, I'm going to put my needle into the pen. Now I'm going to make sure I put 2 units on it and waste that medication. And now we're ready. Okay, I got 4 units.
Okay, let's go and give it to the patient now.
Okay.
Okay, now let's watch Chang give his medication.
Hi, good morning, sir. My name is Chang. I'm going to be giving your insulin shot for today. Is that okay?
Yes.
Can I get your name and birthday?
Kaplan Santiago, July 4th, 1776.
Okay, let me just double check that on the MAR, okay? Okay, we're good to go. I'm gonna give this shot on your tricep, okay?
Oh, okay.
Okay, all done.
Just a side note on administering insulin with a pen, that the most common sites, like the video said, would be the patient's tricep or the abdomen. And when administering the alcohol swab, the best thing to do for a nurse is to pinch the fatty tissue and then poke in the center of the pinch. Press down firmly for about 10 seconds into the skin to make sure all the medication was given subcutaneously. with a simple release.
Okay. Now let's watch Chang document his medication.
So Chang, you're gonna document everything that you did in the MAR?
Yeah, I'm doing that right now, Professor.
Okay. And don't forget to put where the injection was made.
Right.
Okay.
Just
Great.
need you to co-sign this.
Yes, definitely. Okay. Great. Good job.
Thank you for watching our presentation.
Go. First, you need to make sure you have the right medication. Check the expiration date and dosage. It is a rule of thumb that a medication